I'm Antoine Rizk, and I'm an interventional cardiologist at Memorial Hospital. My advice to patients who are still hesitant about taking the vaccine is that we already have enough information about it over the past 7 to 8 months, and we have a very good experience with it clinically, meaning we saw how poorly unvaccinated patients performed as opposed to vaccinated patients in this re-pandemic, if I could call it that way, with the Delta variant. It should be really a slam dunk to go ahead and get vaccinated. Honestly, I thought this should end the controversy, but I was shocked to see that some people are still hesitant about it. There's a difference between being very sick and in the hospital, intubated, fighting for your life, versus a mild illness at home, like really a mild flu with some Tylenol and Motrin, and you'll get over it in a few days. The difference is really night and day. I don't believe that certain reported cases of rare cases of myocarditis or pericarditis should really make you wary from taking the vaccine. The incidence is extremely rare. It is 4 in 1 million. And even these 4 in 1 million are still not vetted cases, meaning these are claims of myocarditis and pericarditis. In fact, the CDC is now in process of looking at every case and make sure that it has merit, meaning clinical merit. Because these illnesses, myocarditis and pericarditis, also occur in the general population without vaccination. But even if it were caused by the vaccine, all of these people had nothing but mild illness, meaning the disease resolved within few days. None of them really needed to be hospitalized, and certainly none of them died. So it was really a very self-limiting mild illness. We already know that people with heart disease and strokes or any kind of cardiovascular illness are at a big risk of acquiring the disease and even dying from it compared to other cohorts of normal people. There are many theories out there. We don't understand exactly why. Some of it has to do maybe with some receptors that could be blocked with some medications. Other possibilities is because simply this is an older population with other comorbidities and other illnesses like obesity, diabetes, etc. The bottom line is that we don't really know. All we know is that they are at a high risk, and therefore those are the people who benefit the most from prevention through vaccination. And those are the people that have been mostly impacted by the vaccination, meaning the mortality is almost non-existent in those populations, whereas it was at its highest with the first pandemic. The most common questions I receive from patients depend on who's asking the question. There are 2 cohorts of people right now. I guess we're always divided one way or the other, but the vaccinated cohort versus the unvaccinated cohort. The vaccinated cohort, by far, the most common question is about the booster. When am I going to get the booster? It is almost certain and almost likely that we are going to get a booster at some point. What's unclear is the timing of it and the logistics of it. In other words, who gets it first? Is it for everybody? Is it few people? This is all open in the air, but it is very likely that a booster is coming. So stay tuned, and we will follow the CDC recommendations. As far as the unvaccinated, the most common is still safety. And really a lot of doubt about the vaccine itself, the vaccination process, the manufacturing. You can add to that some conspiracy theory and so many different factions in this group of unvaccinated. I think my take on it is that most of the people made up their mind to take the vaccine or not take the vaccine. And those that decided not to take the vaccine, each one has his own personal reason. And it seems to me that at this point, if you're still not sold on the vaccination, I don't think there's anything I could say that would convince you. The mortality is there, the data is there. And I think once people made up their mind, I don't think there's any way to convince them otherwise. But I think time will tell that the vaccination is very safe and it is very effective. It is 94% effective against protecting critical illness. And I think the issue is, I think a lot of the unvaccinated people misread what we call the breakthrough infections, which vaccinated people can get COVID which we call breakthrough infections, people read this as failure of the vaccine, which basically is wrong, because vaccination was never made to prevent an infection. They were always made to prevent the critical illness coming from the infection. This has been the case with all vaccinations, including flu vaccines for decades. We always told people, you're still gonna get the infection, but you're not gonna get sick or go to the hospital or die from it. And that's basically what these vaccinations did, all three of them, and they all performed brilliantly. In that regard, they are really very successful, but I think the doubters are reading the breakthrough infections as a failure of the vaccine, which is basically a complete misconception and misinformation. My advice to patients who are doubtful about the vaccination is that pay attention when you read or see something on social media. There's a lot of harmful, dangerous misinformation out there. You don't know who's actually saying that, who's putting the post. You don't know their state of mind or their background. So I suggest you stay away from that. Well, I get asked frequently by my patients, did you get vaccinated? Well, in fact, I did. I was the second in line. There was one person ahead of me when it was released back in January. And all my family, including all my kids, are vaccinated. In fact, I have a daughter who's not 16 yet, and as soon as it was approved for 12 and 16, I took her to Walgreens and she got vaccinated. My own advice to everybody, vaccinated and unvaccinated, and that is a true statement, that I say that to all my patients. You have two options. Unfortunately, there isn't a third one. You get vaccinated or you get the infection. This is how severe, contagious, virulent, and nasty this virus is. It's going to get anybody and everybody, and don't hesitate to vaccinate.